So let's understand now about the physiological involution. That's the physiology of a normal postpartum period. Make sense? After the birth of the baby, what is happening physiologically? And some of the words are not related here. Try to understand. We can find the weight of the baby by multiplying the body circumference and the fundus height. Make sense? We can find the weight of the baby by multiplying the circumference body and the fundus height. So multiply it. How much it will be? 3500. Yeah, it will be 3500. So 3500 is equal to how much kg? 3500 gram is equal to
2.5.
Makes sense? Easy?
Yes.
Okay, now let's understand about this concept called the physiological involution. What does that mean? Look here. After the delivery, we in up to the 10 or 15 days, okay, the woman will still discharge. Up to 1 month, they will still discharge some fluid from their vagina, okay, and they goes through the changes of the color. In first day it become red, okay, after first day it will in first day up to the 2-3 days it become red, okay, and we call this discharge, not the bleeding. We call it as a lochia. What do you call it?
Lochia.
Okay, we do not call it as a discharge, we call it lochia. Like the same way, if a baby is drinking the milk and pooping there, we do not call it as a stool in the first days or second days. We call it meconium. Understandable?
Yeah.
Okay, in the same way, this discharge from the vagina, they will still discharge some of the blood and stuff because they are going, yeah, they are involuting. So lochia are seen, and there are lochias type. Okay, there are lochia in the 2-3 days it become red in color, and we call it as a sanguino. Sanguino means red blood. Sanguino means
red blood.
okay, that's what I like you to understand. Lochia, sanguino means red. Okay, that's what I like you to know. So first lochia is the red one. It goes all the way to the 4 days. So I can put this picture here. And after few days it become the little bit pinkish color. We call it lochia serosa. Okay, it stays up to the 10 days, and within the 2 weeks it become the lochia alba. It become whitish color. Make sense? Okay, so that's what I like you to know. So it's a physiological involution, right? It's a normal physiology. It's not pathology at all, right? It's normal. Make sense? That's why it's called physiological involution. Make sense? Look here, it's clearly stated it is a third day. Which day is the third day after normal birth? Any trouble?
No.
No trouble. Okay, so let's come to the fetoplacental insufficiency. Now from here understand some concept. Okay, fetoplacental insufficiency is caused by placental abruptions, right? If there is placental detachment earlier, okay, we call it as it can cause to a trouble to the baby. We call it fetoplacental insufficiency. Yeah, that's what I like you to know. And it can be because of chronic, or it can be because of some acute situations. Okay, usually when placenta will abrupt, abruption of placenta. Okay, whenever you look here, your placenta is here. Is blood forming over here or not? Obviously, right? Okay, so it's normal.
Yeah.
It's not normal.
No.
So baby will not get sufficient blood, right? And if you have placental deficiency, then obviously baby will not grow normally. So you can see this thing, yeah, from the baby. Look here, pregnancy of the baby was, pregnancy of a woman was there. Okay, gave birth on the 38th week. So it's normal delivery. We call it term delivery. What's the term delivery? 37 to 41 week is a term delivery. Okay, if you give birth to a baby from 37, after 37 week to the 41
41.
week, we call it term delivery. Make sense?
Okay.
That's what I like you to know. The normal length of the baby is 48 to 52 centimeters. So both of them are normal. Look here. But the weight is less, isn't it? Look here. What's the normal weight?
Normal weight is like
1,500 to
2,500 to
4,000.
4,000 gram.
So is it normal?
No. Yeah, no, it's little bit less.
But length is okay, right? Length is 48 to 52 centimeter. Okay, length is 48 to 52
52.
centimeters. So is it normal? It's
No.
normal. But the girl is not growing sufficiently, right? So what does that indicates you? That means the baby did not got sufficient energy. Yeah, that means there was fetoplacental insufficiency that caused that. Make sense?
Okay.
Okay. So if you have understood this concept, and trouble.
No.
Now
Carry on.
when baby are born before the age, okay, they were supposed to born at 37 week. Look here, this baby was born on 32 week. Make sense? Okay. Is it
Yeah.
normal? Obviously no. It's before the term. We call it preterm babies. What do you call it?
Preterm babies.
So preterm babies, and it's 32 week. Yeah. So obviously if it is a 32 week, the lungs are not completely matured. Are lungs completely matured?
No.
Obviously no. So if lungs are not completely matured, then okay, if lungs are not completely matured, then that means there is some trouble, right? Okay, that's what I like you to understand. So at this moment we give a medicine called the corticosteroids, okay, to make the lung mature sooner. Okay, so imagine a baby is there and you have to deliver this baby because of some reason, like indication of the preterm delivery. Please try to understand. We can make the people deliver the baby earlier. There are a reason for doing that. The reason, one of the reason is RH incompatibility or hemolytic disease. Make sense? One of the
Yeah.
reason is hemolytic disease. If the mother and baby have different blood group, if mother is RS negative, baby is RS positive, then we like usually in the 32-33 weeks we will start making antibody against the baby, and this antibody can cross to the baby and cause the death of the baby. Make sense? Do you want
Yeah.
them to die? Obviously
No.
no. So what's the indication? Deliver them before that period. Make sense? Deliver them
Yeah.
before that period. So usually we deliver the baby before the period itself, in the 32 week, 33 weeks. Okay, and to deliver this baby, try to understand, when you deliver this baby, then one thing I like you to understand is, before delivering we always go every week and try to check the RS antibody is formed or not. Make sense? Okay.
Yeah.
And when RS antibodies is formed, then we indicate the cesarean delivery. Make sense? But when you deliver the baby, the trouble is the lung is not matured, right? So if lung is not matured, there is a way to induce the lung maturation by giving the
Corticosteroid.
corticosteroids.
Corticosteroid, dexamethasone.
Okay, that's what I like you to know. Make sense? Any trouble? So fetal respiratory distress, it can be solved by which medicine? Corticosteroids.
Corticosteroid like dexamethasone.
Now let's say, now termination of pregnancy. Termination means artificially inducing the abortion. Make sense? When do you terminate the baby? Obviously, if it is a rape situation, so imagine a woman comes there and she has been raped, and imagine she doesn't want that baby, right? So obviously, that moment you should have to terminate the baby, yeah. And before the, try to understand, before the 10th week, okay, we can induce the medical termination. Okay, before the 10th week we can do medical termination. We can use the drugs, yeah, like, who knows?
Wait.
What's the drug?
Misoprostol.
Misoprostol. Okay, misoprostol. They are the progesterone itself. Okay, they are the progesterone itself. Okay, prostadioles we call it, right? Okay, so we can give the misoprostrals. Okay, ergoprostrals. Okay, they can cause you the medical termination of the babies. Okay, that's what I like you to understand. Make sense? Okay, but there is other indications too, like if baby is bigger, then we use the curettage method. Okay, we use the curettage method to remove the baby. Okay, so a baby can be removed up to the 20 weeks. Okay, 24 weeks usually. Okay, that's one of the points. So we call it as a medical termination, right? And if it is a wanted baby, but if the baby growth is not normal, if baby have some abnormalities like the defect, like the rubella, congenital rubella diseases, right? So imagine if they have the teratogenic effect, right? If there is teratogens, then obviously you want to remove that baby, isn't it? Or if mother is not compatible, if mother's health is compromised because of the baby, because of delivery, you should have to terminate that. Make sense? Okay, so at that moment we do the medical terminations if it is before 10th week. Make sense? Any trouble?
Shaka, what about situations where the mother is having syphilis?
Sickle cell?
Syphilis.
Syphilis, try to understand, there are many situations of the syphilis. Syphilis can itself cause a congenital disease also. Okay, and if baby is within that embryonic period, then we can do the terminations. Okay, but imagine if baby is too big, okay, very big, and then obviously you want to deliver the baby itself, right? Imagine like in the 35-36 week, then obviously baby will be delivered normally and you will start treating them afterwards. Okay, okay, that's what I like you to understand.
Okay.
The treatment is benzyl penicillins. Okay, the treatment is penicillins. Make sense? That's what I like you to know. Understandable? Everyone clear? If you are still not clear, imagine I conceived a baby. I am a woman, and then my baby somehow had a trouble called the rubella, or maybe toxoplasma. Okay, or maybe my baby had a trouble called Down syndrome. You already found it somehow. Then do you want that baby to born and have the trouble the whole life?
No.
No.
Obviously, as a normal person, you will feel it, right? Okay, so you'll say like, okay, let's just terminate this baby, and that's the medical termination. Make sense? Everyone clear? Others
Yeah.
clear on this concept? Okay, let's come to the another concept called the Apgar score. Okay, this question was recently asked, so please focus on this question. This question was asked this year. Previously they never asked. They always used to ask different thing, like imagine if Apgar score is normal, that means greater than 7, you can give the baby the milk within the delivery room. Okay, if Apgar score is less than 5 or 4, that's very severe, right? Okay, that means severe. That means this person should be put to the ICU or some emergency, or this baby will die. Okay, that's almost sure. Okay, that's you should be knowing. If they are moderate, that means you should have to put them into the ventilation or ICU. Make sense? That's what I'll you to understand. So previously they used to ask this sort of question. Look here, like baby Apgar score is 8 to 10. Is it normal or not? Obviously it's normal. So give them the milk within the 13 minutes within the delivery room. Make sense? Okay.
Yeah.
They used to give question, but now they asked a question saying this year that appearance is completely cyanotic. Okay, pulse is maybe like 50. They have given this time 50 or something. Okay, and then after grimace is not present, activity is not present, respiration is not present. What's the Apgar score? And they have written like 0 points, 1 points, 2 points, 3 points, 4 points. Okay, so that's why you should know little bit. Okay, Apgar score maximum is 10, minimum is 0. Make sense? Okay,
Yeah.
if baby is completely blue, okay, we call it 0 point. If baby is blue only in the extremities, in the hands and legs, we give 1 point. If baby is completely pink all over, we give 2 points. Make sense? Pulse, if pulse is absent, we give 0 point. If pulse is present but below 100, we give 1 point. If pulse is greater than the 100, we give 100 points. Sorry, 2 points. Make sense? Now same way, if baby is completely floppy means completely paralyzed. Okay, it does not show any sign. No how do you call it? No hypertonicity of the muscle. Then it's a floppy. Yeah, you give 0. Okay. If baby has some response, that means there is hypertonicity of muscle. They are moving some hands and muscles, right? So it's 1. If all the stimulation is done, it's 2. So make sense? Let's say if they can move, if they do not move at all, it's 0. If they can flex and move hands and legs, we give 1. Okay, if they can move all the things, that is active, that is 2. If baby do not cry at all or do not respire at all, 0. If baby's breath is very slow and irregular, we give 1. If baby's respiration is very high, then they can cry all the way to the hospital. So you have known that screaming of the babies from the movies, right? Okay, so this is the 2 points. Maximum point you will be getting is 10 point. Minimum you will be getting is 0. Less than 3 is trouble. Okay, 4 to 7 is moderate. That means they should be put to the ventilation. There is chances, if you treat them, there is chances they will survive. Less than 3, there is very less chances. It's on God grace. Make sense?
Yeah.
Understandable?
Yep.
Okay. So this, you try to focus on these points. Is maybe they will ask this time too. Okay, let's see. About the physiological jaundice, we have finished this topic from yesterday, I guess. Okay, you know already, right? Physiological jaundice, what does that mean? Yes?
Yeah.
Gastroenterology topic. Let's say the physiological weight loss. That means usually the baby, when they are big enough, also within 1 month they will lose some weight. Okay, they will lose some weight. Okay, and it's normal to lose a little bit weight, not less, maybe up to 100, 200, 300 gram. You can expect the baby will lose weight in a week. Okay, so it's normal, so we call it as a physiological weight loss. Make sense? So there is no hard science, just understand. Look here, baby's weight decreased to 300 gram. Previously it was
300, 1,700.
okay. Makes sense? Easy, right? It's not the trouble. Now let's come to the hemolytic disease. Still, I have did this thing yesterday too. In the hematology, at that moment they are told that there are rhesus incompatibility and the ABO trouble. So I hope you still remember that thing, but I like you to understand. Hemolytic disease of the newborn is caused by the trouble with the blood system, right? Okay.
Yeah.
One of the blood system trouble is the hemolytic disease caused by the RH incompatibility. In this, mother are negative RH and babies are positive RH. So mother will start producing antibody against the baby's blood. Okay, so this antibody can now go all the way cross placenta and go to the baby and cause the hemolysis within the baby, and baby will die. Make sense? Okay, so usually the good thing is this happens usually after the 3rd trimester, usually in the 31st week, 32 week. And at that moment, if you know already, because you can check the blood of the baby, and if you don't know how, then you can do it from the placenta. Okay, we can take the sample from the chorion. Okay, we can take sample from the amniota, and we can check the blood group of the baby, or even earlier than delivery. Make sense? Okay, so we go on checking the blood, and if you found out that yeah, it's the trouble, then we go on checking blood every week whether antibodies is present or not. Okay, if antibody is present, then we indicate the preterm delivery. Make sense?
Yeah.
Yes.
Yes.
Okay, look here this question. A multigravida of RS isonization was found to have decrease in anti-RS titer from 1 is to 32 to 1 is to 8 at 33-34 weeks of gestation. Ultrasound revealed double counter of head, enlargement of fetal liver, placental kidneys, thickness of 50 mm. That means it's showing trouble to the babies. Yeah, it's almost dying. So obviously we need to do premature delivery. Make sense?
Okay.
Okay, so what's the treatment of the blood? Like imagine these babies are born and still there is hemolysis now. What's the treatment? Treatment is the blood transfusion. Treatment is what?
Blood transfusion.
Now we transfuse the RS negative blood in RS incompatibility. Make sense? We transfuse
RS negative.
blood in RS incompatibility, and if it is ABO incompatibility, then we transfuse the O blood group. Okay, make sense? That's what I'd like you to understand. Okay, any trouble here? I believe there is no trouble. Okay, one of the topic is the maternal diabetes, and you might know that pregnancy can also cause diabetes to the mother, right? Because the HCG can isosensitize the insulin receptors. Okay, desensitize the insulin receptors. That's how the woman can be having maternal diabetes. Okay, so how do you know whether woman is having diabetes or not? Anyone is having diabetes or not? We do a glucose tolerance test. Which test?
Glucose tolerance.
And from the question, how do you know this is the diabetes? Okay, look here. On the 10th week, the person started to having trouble like hydraamnion, and the baby is 4086. Baby is what?
4086. It's
normal?
overweight.
It's overweight. Hydraamnion means lot of fluid is there. So lot of fluid, we call it hydraamnion, and bigger baby we call it macrosomia baby. Macrosomia baby. Which baby?
Macrosomia.
Okay, macrosomia baby. And these are very typical sign of the diabetes mellitus. All the diabetic women, their babies are usually big in size. Make sense? Okay, that's what I'd like you to know. Okay, so let's see this. Another question is the same thing, 4086. So I hope you can find the answer. Make sense?
Yeah.
And I have already told you about the prom, so let's skip it. Another thing is about the combined oral contraceptives. You know that if follicular and stimulating hormone are low, then we give the OCP because they will activate them, right? Okay, so they will now increase the estrogen and progesterone, so we can give this thing. Make sense?
Yeah.
And there are many indications. If you have menstruational disorders, if you have irregular menses, if you have the polycystic ovarian syndrome, okay, in all these diseases you can give OCP. Make sense?
Okay.
Now let's come to the probing of the uterus. Okay, this is a technique, okay, to check whether there is a uterus perforation or not. Okay, what is probing of uterus?
To check whether uterus perforation is there or not.
Okay, it's a technique to see whether there is uterus perforations or not. Okay, that's a probing you should be knowing. Okay, understandable up to here? Any trouble? No. I think diagnostic methods is not that difficult for you. You know ultrasound when to do when the woman are pregnant, right? When the menses are irregular, that means menses are not present. Some woman comes there with the complaint like, yeah, I haven't menstruated for like few days, and they are sexually active. Yeah, so to rule out the extrauterine pregnancy, to rule out pregnancies, we do the USG. Make sense? You know when to do the curettage. Curettage is to check whether it's a diagnostic curettage in the endometrial cancers. It can be for the treatment of the abortic parts remaining into the uterus, right? You want to remove that inflammations. Make sense? Okay, it can be used to treat the grape mole. Yeah, that's are the indications that you should be knowing. Easy?
Good.
Yeah.
These are all easy terms, so you can find this answer. It's not a trouble. Look here, this question is, there is punctuated perforations on the vaginal portion of the uterine cervix. What does that mean? It's a endometriosis, right? So blue dark punctuated, it's a endometriosis. How do you find this in the cervical area? You do not do the laparoscopy, right? If something in the cervix, do you make a hole into your abdomen? Obviously no, you put something from the vagina itself, right? From there you can see, and we call it colposcopy. Make sense? That's what I'd like
Yeah.
you to know. So there is no trouble for you on this thing, I think. Okay, like breast mass is there, then you do the excision, you remove the breast, right? The cancers, that's how you do that. So there should be no trouble there. Okay, it's easy topic. Let's say the peripartum period. What from here, what I like you to know is the labor stages, right? During the delivery. Peri means the around delivery. Okay, so here you should know preliminary period. What does that mean? Okay, and I have told you what is preliminary period. Yes, in which your cervix is not dilated. When cervix start dilating, we call it as the labor period, right? Make sense? When there is no cervical dilations. And look here, uterine contractions are not changing. Interval between them is very long. Make sense? That means it's not regular contractions and the interval is very long, right? In the normal or labor period, the contractions become regular. It usually start from 3 to 5 minutes or 2 to 5 minutes. Okay, and they will go like in 2 to 5 minutes, the contraction will be for 25 seconds, 35 seconds, like this. Okay, that's what you should be knowing. So obviously, what is this indicating you? Obviously, this is a preliminary period. Make sense? And
Yes.
how can you differentiate the preliminary period with a pathological one? What's the difference? Look here, how do I know preliminary period? First of all, cervix is
Closed.
Six is closed.
okay, that's the first thing, is a preliminary period. Second thing I'd like you to know is, look here, the what do you see here is this baby. Okay, there is intense labor pain. Is this pregnant woman is having intense labor pain, right? And you can see this look at retroflexions and stuff. Okay, let me put it here. Vaginal examination revealed the uterine cervix was up to 3 centimeter long. Usually it's like 5 centimeter. Is decreasing or not? It's decreasing, right? It's 5
Yeah.
centimeters, so it's decreasing. So obviously,
Yeah.
it's showing there is some pathology. Yeah, it's not coordinating at all. The external orifice is closed and still the cervix is decreasing. Then obviously there should be some trouble, isn't it? And they look here, complaint of irregular intense labor pain. It was not supposed to be that much intense. Yeah, and look here, it started almost 36 hours ago. Usually the preliminary period starts like 12 hours ago or maybe 1 day ago, but 36 is too much, isn't it? That's what I like you to know. Woman will start having the labor almost do you know what's the timeline of labor? Like what's the normal time for the stage first? $12 to $20.
38.
How much? 12 to
12 to 20.
12 to 20 hours. Okay, that's the first stage. Second stage I would like you to know is the 4 hours. Okay, 2 to 4 hours. Okay, they usually from 2 to 4 hours. And then after the last stage is the third stage, that is 30 minutes usually. Okay,
Okay.
that's what I'd like you to know. So how much is total? It's like 24 hours, right? So maximum is 24 hours, but this person is having trouble for 36 hours almost. It's a big thing. Yeah, and trouble. What will indicate the second labor stage? You know already, the cervix should be dilated. Yeah,
Yeah.
Cervix should be dilated.
More than 3 centimeter, right?
It doesn't matter here. The question is asking, look here, there is no cervical dilation, another option. Okay, usually it should be 10, but here is 4 written, right? That means there is wrong answer, but still we have to choose the best option, right? Okay, so best option is this one. Make sense?
Okay.
And look here, cervix dilation stage means obviously cervix will be dilated, right? Okay, so that's what I like you to know. Cervix dilation stage up to 2 centimeter. No troubles there. Latent period, already you know. What is latent period of first stage?
More than 3 centimeter.
Latent is less than 3. Why you are using the wrong answer?
Less than 3 centimeter.
So it's 2 centimeter open, so obviously it's latent, isn't it? That's what I like you to know. So stage 2 of labor is the orifice should be higher, isn't it? So look here, this is still 3 centimeters, so obviously what is the answer? First stage. Yeah, make sense?
Yep.
And there is one position, look here, I told you the baby should be coming outside, right? The baby should be coming outside. Okay, where is that picture? That's the another trouble. No. Okay, we'll come to that point. Okay, baby should be coming outside with the head outside. Yeah, this part. The we call it the I forget the vertex. Vertex of the head should be coming outside. But sometimes instead of vertex, this neck become flexed. Okay, and the face will come outside. Make sense? Okay.
Yeah.
Face will come outside. Do you believe that thing? Obviously, right? Okay, so this thing, when the face will come outside, we call it as the sub-occipital bregmaticus. Bregma means the face. Okay, that's what I like you to understand. Okay, so this is called the sub-occipital bregmaticus situations. Make sense? That's what I like you to understand. These are 1 and 2 questions, so you can even skip it if you do not memorize it. At least you can understand and like skip it, right? Try to memorize. If not, try to understand it. If that does not work, try to memorize it. If not, then skip it, because you cannot just become like 100% in everything, right? That's impossible almost. So let's see, labor stimulations. You know already, like labor stimulation is like assisting technique, right? So imagine if you cannot develop, if your contraction are irregular, if you go through the atonia in the middle, then obviously you should have to go through the labor stimulation, isn't it? Okay, so labor stimulation is a situations in which you will start stimulating the labor, okay, by using the medicines like the oxytocins and stuff. Okay, now what's the indication? Indication is when there is no contractions, right? Okay, when there is no contraction, or when you want to deliver the baby earlier than the time, right? That can be one situations. Or when there is the indications for the labor. Look here, this person has oxytocin test negative, that means this person has no contraction and she is already in the 40 weeks of pregnancy. So you want to deliver this person, isn't it? And how do you deliver? Obviously do not go through the surgery. That's not our invasive way. Yeah, we are not a doctor who loves the blood all the time. So obviously we should give them the oxytocin and start the labor. Make sense?
Yep.
Okay, so if you have understood this concept, then this is the same thing, I guess. Same questions. Okay, undergo obstetric examinations. The cervix of the uterus is undeveloped. That means it's not working. So obviously at that moment you want to deliver the person. Then obviously what will you do? Oxytocin test is negative, right? It's the same question. Then we will start the labor stimulation. Any trouble there?
Nope.
Okay, no trouble. Then let's come to the presentation of the baby. It's a little bit difficult for you. I'd like you to understand here the normal presentations. Usually, I don't know, like maybe I like to skip this concept for you, because imagine if I try to explain, it will be more trouble for you. Let me still show you. Okay. What's the normal presentation of baby, Ankit?
Normal position?
Presentation. How the baby should be positioned.
Cephalic.
Cephalic, right? With the head downside. Make sense? But when it comes out of the vagina, then obviously what's the normal presentation should be? Posterior or anterior?
Anterior.
Anterior occiput presentation, AOP. Yes?
Yes.
Presentation of baby. I just found this picture and then it just vanished out of sudden. Yeah, let's see. Look here. Normally baby should be coming with the anterior occiput position. Make sense? Like sometimes baby will come with the lateral occiput with this side. Okay, lateral occiput transverse, lateral occiput anterior, lateral occiput posterior. Okay, occiput posterior, right occiput posterior. Okay, right occiput. Okay, that's the presentation I would like you to understand. Okay, so which is the normal is anterior occiput position. Okay, that's what I like you to understand. Second thing what I like you to understand is, when you understand this concept, then we will imply that geometry here. Okay, and we will, before that we'll try to see the pelvis of a woman, and we'll try to see the whole pelvis is divided into two part. Okay, one is the external pelvis and one is called the internal pelvis. Okay, okay, let me find the picture, just a second. So see this picture. What I'd like you to understand, we see a pubic tubercle, okay, and we can align this space. If the baby is outside, we call it in the outer, we call it the bigger pelvis. Okay, so you can see the name like the wide pelvic plane, narrow pelvic plane, plane of the pelvic outlet, and then pelvic inlet. Okay, now try to understand outlet means the smaller pelvis. So this part. Okay, baby's head, if they are coming into this part, we call it as the pelvic outlet. Make sense? That's what I'd like you to know. And how do you know that? By palpating this two bone, okay, the pelvic tubercles, okay, we call it. So we will find this tubercle, and from the position of tubercle, we'll try to see. Look here, ischiatic spines could not be detected. Do you see? If ischiatic spines is not detected, that means baby's head is already downside. That means baby has already entered the lower portion of the body. Make sense? That means baby's head is already delivering. If you are still not believing, imagine baby's head was here and it should go all the way downside, right? Okay, so imagine if you could not palpate this area, that means baby's head is occupying those areas, isn't it?
Yeah.
Okay, so if that is occupying, that means they will be coming outside. So we call it the pelvic outlet. Make sense? So if ischiatic spines could be detected, that is pelvic inlet. If ischiatic spine could not be detected, okay, that means it's a pelvic outlet. Make sense? Now
Yeah.
let's say,
Okay.
if that makes the sense, then I would like you to say, come to the similar question. Look here, ischiatic spines and sacrococcygeal cannot be palpated. Okay, cannot be palpated. And look here, the same question. Okay, and look here, they have the narrow plane of pelvis and a wide plane of lesser pelvis. So out of them, what should be the answer? Yeah, that's what they are asking. Then obviously the answer is narrow. And how do you know? You will check the posterior symphysis, okay, and you will try to align this with the fetal head. So you can see the lower edge of the pubic symphysis, ischiatic spines, and sacrococcygeal joint cannot be palpated. All of them cannot be palpated. That means they are in narrow plane of the lesser pelvis. Okay, that's what I'd like you to understand. Okay, so it's a bit difficult for you. If you do not the anatomy, then it's quite almost impossible to find the answer. Okay, instead of memorizing, there is no other option, I'll say. Okay, at that moment. Okay, understandable up to here? Okay, so let's not complicate our situations with this memorization, and I'll try to explain it maybe like some other day. Is that okay?
Yeah. Fine.
Okay, so let's come to the shock. Because of the loss of blood, there can be shock, right? Up to how much percentage is allowed?
5.
5%.
30 to 40%.
What?
Blood loss.
He's in his own world. Okay, he's in his own world. That's what I like you to understand. Maybe he's completely saturated now. Okay, so let's say testicular feminization. Now what I like you to understand is, though man has X and Y, okay, if there is not presence of the testosterone, if there is no presence of testosterone, the organ developed outside will not be penis. Instead it will be vagina. Make sense? Okay, the same thing happened. Okay, here a person has genotype male, okay, but this person is a woman. And how do you know whether man is woman or not? Obviously we see the vagina area, yeah, so it looks like a vagina, then obviously it should be girl. That's what we think easily, isn't it? Okay, so obviously a girl with no amenorrheas and stuff is seen, and then after they thought, but it's has 46 XY chromosome. That's a male, isn't it? Okay,
Yeah.
so what is needed for the development of penis and scrotums? Obviously testosterone is needed. Make sense? We call it dihydrotestosterone, DST. Okay, and this should be needed. Without that you cannot form the penis. That means we can induce the penis formation even in women if you give the testosterone outside. Make sense? That's why some of the girl can have a bigger clitoris and stuff. Okay, so that's what I'd like you to understand. Make sense?
Yep.
Okay, so that's one of the point. This is osteomyelitis. This is surgery topic. I don't know how it came here, but let's understand one point called the post-caval compression. If woman's stomach is very big, then it can compresses the vein. Which vein? Post caval vein. Okay, we another name is the vena cava. Makes sense? Okay, the inferior vena cava vein, and that can cause you the trouble, right? They can cause you the bradycardia. Syncope means blood cannot go to the places to the brain. Then obviously it will be trouble, isn't it? Make sense? Okay, so
Yep.
woman, because of the big stomach, it can compresses the vena cava. Because of that, you can see the less blood will coming to the blood to the heart. If less blood will come to the heart, then less blood will be pumped to the brain, isn't it? And that will cause you syncope. Make sense? Clear? So you can
Okay.
do that answer. Let's come to this pregnancy care. The woman on the pregnant phases has to be always checked by the therapist and dentist. Make sense? Okay, before they want
Why
to become
dentist?
pregnant. Before they want to become pregnant. Okay, so imagine if a woman wants to become pregnant, then they should be going to the internal medicine doctor and the dentist. The reason is because there are many diseases that can cause the trouble. Like dentist trouble can cause the disease like the endocarditis that can fail the heart. Yeah, understandable. So it can cause the
Okay.
death of the baby, maybe cause the endocarditis in the mother. So you don't want them to die. Second thing is like pregnancy is situations where you have seen many changes. Yeah, many disease can occur because of pregnancy. So imagine this person already have some trouble. Do you want them to become pregnant?
No.
Obviously no, right? Okay, so that's what internal medicine doctor would work on, isn't it? They will find the trouble with all the organs. They will make sure your organ is all normal. Okay, make sense?
Okay.
And in Ukraine, I'd like you to understand is, okay, if a person wants to get a medical certificate, okay, and if she leaves the situations, that means if she do not work for some the pregnant period, right? Usually pregnant holidays is for 90 days, for 3 months. How much is the pregnant holidays?
3 months.
For 3 months, right? So 2 months before, or maybe like you can use it anyway, like 3 months, 90 days. It's usually allowable in many places. Okay, so at that moment, if they do not even work, then the constitution have given them 100% salary. Make sense? Okay, they should get 100% salary in that situations. Understandable?
Yep. Okay.
Okay, second thing is the question has been asked where the uterus fundus locates, at what timeline uterus fundus will locate in the navel. Then obviously answer should be 24
24.
weeks. Make sense? And second thing is adage incompatibility. I told you, if you want to determine whether they will need the surgery or not, you should do it every
Week.
week. Make sense? How often should the antibodies should be determined hereafter. Understandable? See, everything that
Yeah.
I'm giving you, if I'm talking and explaining in time, giving the time, that means it's a high. That question has been asked already. Okay, understandable? Look here. And now, how do you treat the hemolytic disease? Obviously by
Blood
blood
transfusion.
transfusion.
Blood
And
transfusion.
please, there are two ways. Look here, conservative therapy and replacement blood transfusion. Then obviously we say the answer. We are replacing the blood, isn't it? We are completely replacing the blood, right? We are removing all the blood of that baby and replacing it with the new blood. Make sense?
Yeah.
So obviously which blood?
We give RH negative or O positive.
RS
Oh.
negative in the RS incompatibility and O in the ABO incompatibility. Make sense? Any trouble?
Okay.
Okay,
No.
no trouble there. Look here, this question has been asked on the full term infant with prenatal growth retardation. This is the fetal insufficiency. Okay, that means baby is small. Okay, but the look here, baby's weight is 2400 gram. Make sense?
Yeah, it's less.
Okay, so it's the growth retardation. Obviously there is should be no trouble. Dysfunctional uterine bleeding, already you know. Let's come to this concept called the hymen atresia. Atresia is the formation of tissue. Some woman will not bleed. This woman is not bleeding. Okay, she is 14 years old and she wants to find out why. Then what she found was her hymen was not torn. That means the hymen is very intact and is closed. Make sense? And if hymen is closed, can it be seen? Sorry, can they bleed? Obviously no.
No.
So if vaginal hymen is present there completely and it's completely covering it like a lid, all the blood, instead of coming outside, they will start depositing into the uterus. Make sense?
Yeah.
Okay, so it's a hymen atresia. Understandable? So this person is not bleeding. Why? That's the question they have asked. And the question has said like vaginal membrane. That means hymen is intact. Cyanotic and protruded. Why cyanotic? Obviously it's bleeding over there. She is menstruating, but because of hymen it's not coming outside. Make sense?
Yeah.
Okay, that's what I like you to know. Let's see. Another is the this person has epicanthal folds and the corners. This are all showing you one thing called the Down syndrome. Okay, all the symptoms refers to Down syndrome. Okay, mental retardations, the slant eyes, moon-like face. Okay, flattened face. Okay, these all are example of what? Symptoms of Down syndrome.
Down.
So what's the Down syndrome? It's a chromosomal abnormality, isn't it? You have trouble with which chromosomes?
Chromosome 21.
Chromosome 21, right?
21.
Okay, so you will have trouble with the chromosome 21. That's what I like you to know. Any trouble there? No trouble. So this question, I don't know, this question is something from another topic. Okay. Okay, now look here. Which gestational age gives the exact week of pregnancy? Estimation of pregnancy below 12 weeks. Makes sense? Below 12 weeks. That's why the fundal height is not that accurate measurement before. Okay, after 12 weeks. Make sense? That's why we always measure the size by saying like, yeah, a uterus size look like the 9-year week of pregnancy. Make sense? That's what I told
Yeah.
you. Yes. So these are all the simple questions that you will be finding. It's not difficult, so you will be searching these by yourself, all the remaining questions. Okay, now let's come to the postpartum course of the physiologic course of the postpartum period. Okay, from here what you should be knowing is, okay, you know already this physiological course, right? There is sanguineous, okay, uterus will involute, okay, that's you know already. So I can skip this thing. Physiological course of postpartum period, you know, blood is lochia in the 2nd to 4th day is normal, right? It's a normal physiology. It's a normal physiology. It should not be trouble. Okay, the 2nd day lochia should be which color?
Pinkish.
Yeah,
Red.
red color. Who came here with the idea of pinkish? Okay, so it's not the thing. Now let's come to the hypoxia. Okay, hypoxia and asphyxia. Now usually asphyxia and hypoxia, what happens is baby goes on drinking the amniotic fluid. Make sense? Babies goes on drinking the amniotic fluid, and sometimes they will poop also because of stresses. Because of fetal distress, they will poop. This poop is called meconium. What do you call it? Meconium.
Meconium.
And this meconium will now go to the mouth, okay, go to the lungs and obstruct it. Make sense? Okay,
Yeah.
and that can cause the trouble now. Okay, and because you have difficult breathing, we call it asphyxia. Asphyxia means difficult breathing, trouble breathing. So see from the question, look here, the pea soup amniotic fluid is in. What does that mean? You have now mixed the meconium together with the amniotic fluid, right? Yes.
Yeah.
And he is apneic. Apneic means he is not breathing at all, right? Limp and pale, you know already. Now if the If the amniotic fluid is pea soup, that means he has pooped, he might have ingested also, and this thing has gone to the trachea and blocked the respiratory tract. Make sense? Okay. And obviously, how do you treat that disease? You should have to now remove those meconium, isn't it? First of all, make clear of the meconium and give them the oxygen. Understandable?
Yes.
Okay, so we call it this thing. Say
Direct laryngoscopy.
now, make sense? Any trouble here?
No,
No
fine.
trouble. So what is asphyxia? Difficult breathing. Look here, a full-term baby born with the blue skins and everything. That means hypotonia. Everything is there. Look here. See this question. From here, can you find the Apgar score?
Yes.
Okay, look here. A means appearance. Blue skin means completely zero. Make sense?
Yes.
This means zero. So count 0. P means, what is P means?
Pressure.
Pulse. P means pulse.
Okay,
Pulse is less
pulse.
than 100. That means 1, isn't it? Pulse is less than 100. That means 1. So heart rate is 1. Make sense? Up now it's 1. G means grimace. Grimace means the muscle tone, hypotonia. It means 0. Okay, it means 0. And APG, APG A. Now another A means whether the movement is there or not. Okay, so you see this is also not present, so muscle hypotonia, that's 0. Okay, and R, respiration is present 26. That means it's less, right? So obviously it's 1. So the Apgar score is only 2 of this person. Make sense? Okay, and what is causing that? Okay, during catheter suction, mucus and amniotic fluid from the nose and mouth, child reacted with a grimace. Make sense? What happened? You put the suction and you remove this space from the nose and mouth, and now the baby cried. Make sense? So you remove the blockage. When you remove the blockage, obviously you remove the asphyxia, isn't it? And that's the thing. Okay, so what is the most likely diagnosis? Asphyxia. Asphyxia means the blockage of the part of the lungs, right? Of the trachea. So that was causing you the difficulty in the breathing problems, isn't it? Look here, this
Yes.
fetus has 100 BPM. Is it normal? Obviously not normal. Okay.
No, 120 is normal.
Obviously not normal. So if it is not normal, and look here, if no blood coming outside is shown, nothing is written, is it a premature detachment? Obviously no, isn't it? If placenta detaches, then blood should be coming out of the vagina. Make sense? Okay, so only thing we can say, it is hypoxia of the fetus. Make sense?
Yeah.
Okay, so that's what I like you to understand. Post-mature baby means some babies were supposed to, all the babies were, normal babies were supposed to born before 41 week, right? But some of the baby get born after 41 week and still, because you might be thinking, yeah, they are more mature. Obviously no. What happens when you are born more than that, then growth will be restricted and this people will become smaller and smaller. Make sense? Okay.
Okay.
So you'll see the baby is 2400 gram. Growth restriction is seen. Okay. But the baby is in 41st week. So post-mature. Make sense?
Okay.
Okay. Now let's see the physiological obstetrics. That means teratogenic period is the 3 to 8 week. Teratogenic period is,
3 to 8 weeks.
so if you expose the baby within that period, your baby will be born, deformed baby will be born. What type of baby will be born?
Deformed.
Deformed baby. So obviously ionization radiation is a teratogen, right? So they are ionization radiation, they are asking at what age of the baby, okay, ionization radiation can cause the trouble. Okay, then obviously 3 to 8 weeks. So 3 7 the 21 to 8 7 the
56.
56.
56 make sense. Okay, that's what I like you to know. Understandable. Okay, up to here any trouble? No trouble. Now if baby are having difficult to born, then we make a cut in the vagina, in the epistomy areas. In which areas?
Epistomy.
Epistomy areas, that means in the anal areas. Look here, if this vagina is small and it's still difficult to get born the baby, we give birth to baby, then we cut this part. Make sense? We cut this part and make the vagina bigger, okay, so that baby will be easily born. Okay, and we call this technique as the episiotomy. Make sense?
Okay, episiotomy.
Understandable? What do you call it?
Episiotomy.
Make sense? That's what I like you to know. And look here, this person has the disengagement has started. That means slowly the baby is coming out. Yeah, but look here, the perineum has become very grown up and become pale color. That means the perineum means this area has become completely pale color. That means it's going through a lot of pressure. Make sense? Okay, so to relieve that, what will we do? We cut this perineal area, isn't it?
Yeah.
Okay, so that baby will be born easily. Okay, so that's what I like you to know. Understandable?
Yes.
Okay, now let's come to the surgical treatment. Okay, you know, episiotomy surgical treatment is like for most of the like cancers and fibromyomas and stuff. Yeah, so if you have the uterine cancers, you remove the whole uterus. We call it uterine extirpations. Yeah, that's what I like you to know. If vagina has a bleeding in the posterior wall, we can see the vaginal wall rupture, then blood will be accumulating into this wall. We call it vaginal hematoma. Any trouble there? No trouble, it's easy. Okay, coulodoscopy, look here, of examination need to perform to diagnose the situations. Okay, gynecology, so the without changes and deflections, both peculiarly the family doctor make provisional diagnosis of uterine bleeding. So abnormal uterine bleeding is found by which technique?
Coulodoscopy. The transvaginal examination will be, no?
Coulodoscopy. Sorry, not transvaginal ultrasound. Okay, so that's what I like you to know. That's what I was thinking. Where did this coulodoscopy came from?
I was also confused.
Okay, makes sense. Okay, understandable, right? Okay, look here.
Yep.
Now, this same thing here is if you want to look here, an employee had an abortion, then for abortion, the legally you can stay 12 days. How many days?
12 days.
Okay, medical sick list will be made for 12 days. Who makes the medical sick list?
Medical commission.
Medico-social expert commissions, right? Okay, they makes the medical sick list. Okay, so they will give for 12 days. Okay, second thing, this is a topic of the I don't know why it came here. It's a topic of the nephrology. So let's see, and you know this thing, this is the topic of again pediatrics. In 1 year of age, okay, sorry, in 2 months of age, usually 1 kg should grow. So obviously 3,500 to 4,500 after, sorry, 15 kg, sorry, 1.5 kg is allowed. Yeah, so obviously this baby is within the normal range. Okay, it was 3,500 when it was born, and then it become 4,900. Make sense? That's allowed. So you just have to memorize that concept. This is thing which we have already did. This thing is logical. Now try to understand. When we add the 3 months, okay, 3 months in the last menstruational period, 3 months plus 7 days. How many days?
3 months plus 7 days.
7 days in the last menstruational period. Okay, then it gives the delivery date. We call it estimated delivery date. Make sense? How do you find the estimated delivery date?
3 months from last period adding 7 days.
Plus 7 days.
Okay, so if you understand this concept, then I'd like you to understand one thing. Okay, so this is this will give you the estimated date of delivery, EDD. So EDD will be how you will do. You will, like, imagine you will decrease 3 months from LMP, plus you will add 7 days. Okay, look here. This person has menstruation at first 10, yeah, October, December, October, November, December, yeah. So it's like October she was pregnant in the first day. So when is the date of delivery? Then decrease 3 months. How much it will be? 10 minus 3 is equal to 7. 7 means which month? July, right? Okay, so July is given. So July plus, so it should be like is equal to July.
Plus 7 days.
So try to understand. July 08. Makes sense? And now we just have to make it in the next year. So it is like 2003. Understandable up to here? No trouble. Now this is saying like when she should take the maternal leave. Okay, then obviously she should be taking, okay, after months, right? Okay, so imagine after delivery you should take the maternal leave, right? So you can, because you have to feed the baby with milks and stuff, obviously. So will you want to leave that? Obviously no. So answer is 8 August. Make sense? Understandable, right?
Yeah.
Okay, so that's the answer. Okay, that's what I like you to understand. And I am trying to find one point here. Did I skip it or what? Where is the uterine rupture? Prepartum, postpartum, normal delivery.
Yep, I think you missed it.
Okay, now one point, like so there was a question. Maybe I have rupture. Maybe I have erased it somehow by some mistake. Okay, it's here. We have did right, impending ruptures and the,
Yeah.
we have did right. Yeah,
Yes.
we have this. How come I even forgot that? So this is all for the all for this gynecology. Okay, this include all the questions that have been asked till now. Hope you have understood all the concept. Please go on repeating. Okay, is there any other questions other than this for you in the gynecology right now?
No, we have to just prepare this. Just make sure Shekhar post the video because we have to watch it and just revise everything again and again.
Okay, I'll be posting videos.
Shekhar?
Yes, sir.
Yeah, actually, I have a question not related to this, but like I have read a case about the double uterus.
Which uterus?
So,
Double uterus, right?
yeah, double uterus.
Uh-huh.
So, like, can you give me some kind of, brief introduction?
So
Like
double
how,
uterus
because,
is like
mhm.
some people can have double uterus. Understood? It's like a developmental trouble itself. Like
And it's
instead of
congenital, right?
delphys, we call it didelphys.
D, okay.
Okay.
Mm-hmm.
In human, let's see. I'll show you. Okay. So they can have the they can have the two uterus. Okay. Just a second. Okay. Spelling might be colored. Okay, might be wrong. Two uterus. Like this. Okay. Yeah. Uterus didelphys. Make sense? Okay, so at that
Yes.
moment they can have two uterus. So in that moment, then they work as two independent uterus itself. So imagine if you have sex with a woman with this thing, then obviously maybe she can have two babies simultaneously. Make sense?
Yes, but
Okay.
like it can be twins easily,
Yeah,
like that.
but the twins is not the common twins, so we call it the dizygotic twins. Okay, it's like giving
Like,
two different babies, but at the same time. Make sense?
no, but at the time of delivery, like there will be complications, right?
Yeah, there can be complications too. But one that's why usually if you have twin babies
Mm-hmm.
and stuff, usually the vaginal delivery is almost impossible, right? Okay, people usually go through the
Mm-hmm.
cesarean sections.
And what about the menstrual cycle, like in case of the double uterus?
It's normal because the hormone will be
Mm-hmm.
produced on the same time, right? Okay, so it will stimulate in
Okay,
the same time. So there are
okay,
another like normal, even this type arcuate. There is bicornuate, unicornuate, septate. Okay, there are many types of the uterus. Okay,
okay.
okay, that's what I like to know. Understandable, everyone?
Okay.
Okay, so this is all for today. Okay, thank you so much, everyone. Okay, we'll see you
Thank
in
you,
next
Shekhar.
Yes,
Yeah, thank you.
happy birthday once again.